Welcome, everybody, to the last in the NCDE 2024 Spring Webinar Series, Health Matters Abroad. And in this webinar, of course, we're going to talk about all of the things health-related that students will encounter, medications, insurance, etc. We have a couple guest speakers with us from the University of Michigan and from Columbia Law School who are going to be sharing their point of view with you. Generally, let's go on to slide 2. And so just a really quick summary. We're just going to ask you all to please keep your microphones muted. And also, unless you're presenting or asking a question, to keep your camera off. If you have a question, you can send that to the chat. And my colleague Lori will be keeping track of your questions. So on today's agenda, up on the slide, just did some housekeeping. Welcome, we did that. Then presenters will briefly introduce themselves. We'll spend some time hearing from our colleagues from the University of Michigan. We've got the Ayesha, Usmani. Well, you know what, I'm just going to leave them to present themselves. But we've got we have our international travel safety manager and a senior intercultural advisor to be sharing about they're going to be giving some a slide presentation. We'll have a moment for questions after their remarks, and then more or less probably at the 40 to 50 minute mark, we'll start a panel with our two students, Kristen Popham and Emma Griffen. And there will be probably about the 75 to 80 minute mark time for more of your questions. So with that, let's go to slide 3. And my name is Justin Harford, and I'm a program specialist. You probably already know that, with the National Clearinghouse on Disability and Exchange, a program of Mobility International USA. And I'm going to toss it on to my co-presenters to present themselves.
Thank you, Justin. Hi, everyone. My name is Ayesha Usmani. I work at the University of Michigan as an international travel safety manager. In relation to this topic specifically, I assist with our institution's health abroad insurance, manage emergencies, and provide pre-departure training.
Hi, everybody. My name is Callie Rouse. I am a Senior Intercultural Program Advisor at the CGIS Center for Global and Intercultural Study office at the University of Michigan. University of Michigan is many offices, but we are the largest liberal arts college office. And I work day to day with students studying abroad. Specifically in my office, I am the liaison to our Students with Disabilities office, and also have experienced being disabled abroad myself.
Hi, my name is Emma. I'm excited to share the student perspective today. I'm a rising senior at the University of Michigan, and I spent a semester studying abroad in Madrid. And with that, I'll pass it off to Kristen.
Hi, everybody. Thank you so much for joining us. My name is Kristen Popham. I'm currently a second-year, rising third-year student at Columbia Law School, but I'll be talking a little bit about my experience actually as an undergraduate studying abroad at the College of William and Mary, where I studied abroad in Montpellier, France, and also studying as a Fulbright scholar in Paris, France, in between undergraduate and law school.
Perfect. Thank you, everybody. And now I'm going to pass the mic on to Ayesha to take over with your guys' presentation.
All right. So this is just an overview and framing of today's topic. So for us that work in the education abroad space, of course, one of our primary goals is to keep our students safe and healthy while abroad. In terms of health, the mindset is often, what if you get sick at your host destination? What if you get injured while abroad? Where are the nearest medical services? Do you have adequate health insurance coverage? And these are perfectly valid questions. However, for the scope of today's session, we are focusing on students with underlying health conditions such as, disabilities, chronic illnesses, and so forth. We will touch a little bit on mental health in terms of medication, insurance, and advising considerations, but that's not going to be our primary focus since it's a topic on its own. So our main focus, of course, will be health matters, and then as well as some safety considerations while a student is abroad. And so I will pass it to Callie to get us started.
Thank you. So for next
And also,
slide.
oh yeah, thank you for announcing the slides. That's all.
Awesome. So yeah, first of all, I'm going to chat with a little bit about overall health and safety considerations that study abroad offices and study abroad advisors when meeting with students should be kind of like thinking about and thinking about in the planning stages of things. So first of all is kind of approaching things with an inclusive mindset. So we do want to focus on, how we can be inclusive and make our programs inclusive from the beginning, and considering a full spectrum from mobility, visual impairments, deaf, hard of hearing, cognitive, developmental, intellectual, and other systemic related challenges. So I think we often will be like, okay, this is like physically inaccessible location and things like that. It's kind of generally easy for us to kind of observe and things like that, but thinking about the other aspects are really important too of what kind of load this kind of program might have on students. With program activities, it's important to see if required program activities can have reasonable alternatives. So for example, there are certain activities that are very physically demanding or can be very difficult emotionally. And so, thinking about what are topics and activities that may be triggering, and do you have built-in debriefs and reflections to handle those? And are we thinking about how this may impact, a wide range of student with different student backgrounds? Next slide. Another thing to consider considerations. So what is the physical accessibility like within the destination, such as transportation signage, sidewalk access, restaurants, grocery stores? This is one thing that's really awesome about if you are able in a study abroad office to visit sites. That's one of the big things that we emphasize in our office is making sure that you're kind of chronicling what does the physical space of this place look like so that we're able to better advise. We also want to make sure we are exploring local attitudes towards disability and mental health, as there can be a very strong stigma about talking about disability and mental health concerns, as well as stigmatizing behaviors that that actions against people that people may experience in certain countries higher than other countries. Another thing is sites. So if there are inaccessible sites or buildings, how do you make a plan for that particular activity or a place that could be adapted to make it accessible? This past spring was able to visit one of our program partners, or a couple of our program partners in Prague, and a couple of the locations were very inaccessible, and it kind of controlled like where I was thinking about like, okay, if we do a custom program with them, this one would be less accessible physically for our students because it's a really big hike to get up into it than others. And that's a factor in what we want to do with them going forward as well. Next slide. So transportation. So what are the transportation options that you're arranging that students may be using, or that the students may be using on their own? Are they considered accessible? And in what level of accessibility? Like if you can manage a couple of steps, could that be possible? If you cannot, is that possible for those students to access it? And if you record alternative options, are these options safe? Additionally, housing. This is a really big concern that comes up a lot in our office is around housing considerations. Is it accessible, and is it going to be safe for students to be in for a variety of different reasons? And if accommodations are requested, do we have a budget or options for alternatives? If the main option doesn't work, is there something that we can do to find them a place that will work? Next slide. So when we get into the advising side of things, I think one part that is very kind of like frustrating for a study abroad advising staff is why students don't disclose, because there maybe end up a problem on site and we're like, oh, we really wish these students would just tell us earlier. Why aren't they doing that? There's a variety of reasons. So one is that students may believe that disclosure will risk their spot on the program. So it's really important that we're informing students that we do not take disability into consideration when setting up or like preparing a student to learn about the programs and learn about what study abroad is like, that if you disclose to us, it's not going to impact your access. I also very deliberately keep any information about a student being disabled if I know in advance from a partner organization internationally that doesn't have the same legal protections that we do, until the student has actually been admitted to the program, just as an additional like measure. Another thing to consider is discrimination due to disability is high on students' minds. If the student has a invisible disability where people can't obviously see it, they may wish to keep it that way because of barriers and discrimination they've experienced. And so it's really important, again, that we are educating our faculty and our staff at large about how to reduce barriers to make it so, you know, like we have documented cases of a student that it disclosed and they had a positive experience. So maybe it can encourage other students also to share with us as well. Next slide. So general advising tips I have is making sure that you provide publicly available information on disabilities for students who may not wish to disclose to you personally. I never take it as personal affront if a student doesn't want to talk to me about their specific disability. I just need to know very baseline information for my role, and I want to make it as obvious for them as possible how they can go about doing it with as little or as much involvement as they want me to be involved in the process. We also recommend considering including disability and accommodation questions on required forms, so that they can, especially this is kind of like on the on-site side of things, that you are asking these questions before the students arrive, and you're preparing for, okay, what if a student needs a disability housing accommodation, and you have built it into the system. Additionally, we recommend having disability disclosure statements on emails and flyers. So kind of talking about the fact that like we do not use disability as a factor in accepting students, and also just including things that are like mentioning and talking about accommodations that can make a more open environment to talk about disability. When you're talking with students directly, I recommend kind of inquiring about what services and resources they use currently. We can kind of see, okay, what are we working with here in the US and what are we able to accommodate possibly abroad, especially if you have kind of an idea of what that country or city is like, you can kind of provide some context. And then also focusing on the accommodation and not the disability. Like I said, I don't really focus on needing to know the disability. I can help you whether or not I know why you have extended time on tests and things like that. I just want to make sure that I am there to support you. And then students can generally speak to their own experiences and what it looks like in the context of current campus. I always consider like we may be the experts in study abroad, but students are experts in their own experience. Next slide. So again, students should always be in the driver's seat. Students have often lived years, if not their entire life, with the disability that they have, and they know themselves best. And this is also a chance for them to grow and be able to, maybe gain confidence in being able to go internationally while still being able to navigate their disability. Appropriate arrangements should be sought out with serious consideration and creativity. If it doesn't seem like it's going to be possible from the get, thinking about what is alternative options. And finally, our goal is ultimately to help them make an informed decision and have their backs if they hit stumbling blocks along the way. We can't make the entire world accessible for students, but we can help them make the decisions that are going to make sense for them, and help them with the knowledge that we have. All right, next slide.
All right, thanks, Callie, for setting up that framework. We're now going to dive into a little bit more about the health considerations, and then, of course, our panelists are going to share their experiences as well. And so, in terms of traveling abroad with medication, one framework to consider is the legality of the medication. So certain medications such as narcotics or opioids, psychotropic drugs, strong painkillers, are considered illegal in several countries. And the best way to determine that, whether you are allowed to bring a certain medication with you, is to start with two resources is what I recommend. The first, and probably your primary resource, is your destination's embassy, as well as any of the embassies of the countries that you might have layovers in. This information could be possibly listed on their website, but if it's not listed on their website, you may have to contact them and ask specific questions. Another online public resource is the International Narcotics Control Board. This website provides just general information about narcotics and controlled substances. Sometimes it's not always up to date, but it's at least a publicly available resource that someone can review. Next slide. The next item to consider is access and availability. So now that you are bringing, or the student knows that they're bringing a specific medication, the next questions they want to ask are, what supply are you allowed to bring, and how long are you going to be there? And if these timeframes don't match up, like you have less supply and you're going to be there longer, ultimately, what are your next options? So one thing to consider is, can you fill your prescription? Or if you're getting testing supplies or you're getting injections and so forth, can you get these abroad, either through the pharmacy, or some of them might be available over the counter depending on the medication itself. The next consideration is the cost of those items. So will it be covered by your health insurance, or will you need to pay out of pocket? And I'll go over insurance a little bit more in the next section. And then finally, if your medication is either not available or not allowed at your destination, you want to take some time to consider what are your alternative options. So some medications might have an alternative. There could be a different brand that you could use, but you probably need time to see if you react well. Are you getting side effects to them? Some medications are unfortunately cost prohibitive, or they're not covered by insurance. So if you have students in this particular situation, it's really important that they have these conversations with their healthcare provider as soon as possible, depending on the destination that they're going, just because there is some lead time involved with this process. Next slide. Another item is just general packing tips. So of course, as best practice, carry any medication that you have in your carry-on luggage. You don't want to have it in your checked luggage because there's always a risk of it getting delayed or lost. Another good best practice is to keep any medication in original labeled containers. I am guilty of this. Sometimes I just keep tiny little packets of like Tylenol with me, but it's probably best practice to keep it in that original labeled container. Many countries do allow a 30-day supply of certain medications, like even the ones that might be restrictive of what is allowed in the country. But in those cases, you might have to carry the prescription of that medication from your doctor, or a medical certificate of, what is the medication, what's the dosage, and those specific details from a healthcare provider. Next slide. So health insurance considerations. So if you work in a department that determines which health insurance abroad provider that you're working at, like in my case, and the type of plan your institution provides to its students, then hopefully you are advocating for specific benefits that fit a wide variety of health needs, travel destinations, and within a reasonable budget. And if your current offerings do not meet those needs, look at your peer institutions who might have better coverage, and then try to see if you can leverage those, examples and those benefits in your next round of negotiations or renewals. On a more individual level, if you are looking at specific health insurance plans, if you're not going through a university, or that institution doesn't have an option available, some things to consider when you're choosing a health insurance plan. See the number of in-network providers in relation to where you are going abroad. Check to see if prescription medication is covered. If you need access to mental health counseling, as well as, you can also consider telehealth counseling as an option. See if those are available in that health insurance plan. For those with pre-existing medical conditions, we understand, of course, it is very challenging. Back again to any of those staff who are choosing an insurance provider, you really need to make sure that you can make sure that pre-existing conditions are covered. If you are a student choosing an individual plan, I consulted with our insurance provider. So our university currently works with GeoBlue, and they shared that typically if you are doing an independent route and not going through the university, if you have proof of current or proof of prior medical coverage that covered those pre-existing conditions, then you should be able to purchase health insurance coverage for abroad. But we understand that there's always exceptions to that, and finding that right insurance is definitely important. Another item to know is that some health insurance plans accept pre-existing coverage, but only if you purchase in a certain time period. So that's something also you want to take into account. Right, next slide. So the next set of considerations in terms of health insurance is just accessing the medical care itself. So especially with students with disabilities or chronic medical conditions, you want to do research to see if you will have access to specific specialties based on your health condition. You also may need to schedule reoccurring appointments ahead of time. So having that relationship either with the insurance provider or with your host country partner and host hospitals and clinics that you might be working with, you want to make sure that relationship is established. Of course, see if there are teletherapy counseling options. Sometimes in-person psychiatric or mental health services aren't always available. So seeing if there are some telehealth options is a good alternative. All right, next slide. And so, of course, while our focus for this session is health insurance, Callie gave me a good reminder that there are other insurances that you want to direct your students to consider in terms of other types of insurance. So one is travel insurance and one is personal property insurance. So for example, let's say you're working with a student who has a mobility issue, and let's say they're at the airport, they finished their program, they're about to go home, but their flight is canceled. And so let's say the airline offers them a voucher for a hotel that's like 2 miles away, but in their case, it's inaccessible. And so they have an option of staying at an airport hotel, which might be more accessible for them. And so if they're paying for that extra cost, maybe if they had travel insurance, that could cover potentially those extra unexpected expenses. Another scenario could be that if you have a student who's using a walker, like a mobility device, and somehow it gets lost or damaged during transit or while they're at their host country, health insurance might not necessarily cover the replacement item. It may or may not, but personal property insurance could. So that's something that to consider if you are taking physical items with you, that could be a separate insurance to consider. And with that, that is an overview R section, and I will pass it to Justin.
Thanks, Ayesha and Callie. Great job. Great presentation. And I want to take a pause and ask Lori if there are any questions from the audience in the chat.
Thank you, Justin. There are no questions at this time.
Okay, great. Well, I just want to note the audience, you're welcome to post any questions to the chat, either for our students who will start shortly or for our professionals. And there will also be time at the end as well. So just pulling up the questions on the first slide. So now we are at the panel section of the workshop. And I just want to first invite our exchange alumni to give introductions, just very brief backgrounds, who you are, where you studied, etc. And so let's go ahead and start with Emma.
Hi, as I had introduced myself earlier, my name is Emma. I study at the University of Michigan. I'm a current senior, or rising senior, excuse me. And I study biomolecular sciences as well as Spanish. I studied abroad in Madrid, Spain. I did a language immersive program through a provider program. And I have ulcerative colitis, which is an autoimmune disease. And overall, I had a good experience with managing my autoimmune disease abroad. But it did require a lot of planning, I will say up front. So yeah, I will pass it off to Kristen with that.
Thanks, Emma.
Hi, everybody. Thanks, Justin. This is Kristen Popham again, and I studied at the College of William and Mary for undergrad. I was there from 2016 to 2020. In 2018, I spent my fall semester at a university in the south of France in Montpellier, where there was a relationship between my home institution and the host institution dating back many years, but I was able to receive treatments for my juvenile idiopathic arthritis, or now my adult diagnosis is rheumatoid arthritis and uveitis. So managing transition of medical care, infusion therapy, etc., to France. In Montpellier. And then I was also had the privilege of in 2021 traveling to Paris, France, where I was an English teaching assistant at a school in the suburbs of Paris, and also continued managing my rheumatoid arthritis from France during that year, just after as we were sort of emerging and still in the COVID-19 pandemic. So I can't wait to share a little bit about my experiences with you all today.
Thanks, Kristen. And the next question is, how did you select your experience abroad? So it seems like you kind of got into a little bit of that. It sounded like for the first experience, your institution had a partnership with that program abroad. And I mean, it sounds like had you done quite a bit of research before to also figure out a country where you'd be able to manage your disability?
This is Kristen speaking. Yeah, it was in part motivated by the fact that I was studying French and Francophone studies. I was a double major in French and government. And so I knew I wanted to do something where I would be able to engage in language studies. And since my school had an existing partnership and was already in touch with the host institution and the people there, I thought that was a really safe bet. It also had to do with the financial implications of study abroad, I received loans that went directly to my university. And so I was able to transfer those loans to my university during study abroad without having to get like third-party loans to pay a third-party institution for my study abroad. So it was partially based on my disability, but also just kind of based on my interests and what was feasible at the time. In terms of why I chose to go to France for my Fulbright scholarship, that was a little bit more concentrated on disability related reasons. I knew I wanted to speak French, but in terms of the countries available to me, I was also thinking about places that were had vaccines available at the beginning of COVID-19, and also places where I would be able to access health insurance at a greater ease, as well as had a network of doctors that could help refer me to other doctors. So since I had that experience navigating the French system in the past, it seemed like the obvious place to try and lay roots in 2021.
Thanks, Kristen. And I'm going to toss that question on to Emma. So how did you select the program that you ultimately chose in Madrid?
So I kind of started with looking at what I'm studying, and I wanted to do a language intensive program in Spanish. And so I started looking at Spanish speaking countries. But with that, I took into consideration, I can't receive any live vaccines. And so is this a country where I would potentially be exposed to a bacterial infection that could be not good? And so that was something I considered, just like general population health. Is there a certain bacterial disease in this area that if I were to go there, I would be potentially putting myself at risk? Another thing I considered was spoken language. Spanish is my second language, and so if I were in a situation where there was an emergency, how would I be able to communicate with people around me who might not necessarily speak English about things that I will need? And then another thing that I took a lot into consideration was transportation. One of my big symptoms is when I get into a flare-up is mobility or fatigue. And so if the doctor's office is 2 miles away, is there a metro that can get me there, or is there like a taxi option I can take to get there? And that leads me into my final like major consideration is what is the healthcare like in this country? And so how much of a like healthcare fund, emergency fund do I need to take with me? For example, if I need to take a taxi to the doctor's office, how much money would I need to budget for these things in case I'm in an emergency, or if I'm in a flare-up, feeling pretty fatigued and I don't think I can get to the metro stop that can take me to the doctor's office. So yeah, that was a little bit, those were a basic umbrella of what I considered.
Thanks, Emma. You made an interesting point about a healthcare emergency fund. Kristen, I know your condition also involves some management cost. Had you ever thought about that, an emergency fund?
Actually, I dipped into an emergency fund during my time in Fulbright. So I was able to benefit from Fulbright's kind of savings that they put away for students in peculiar situations like my own at the time, where I had to pay a decent amount out of pocket at the very beginning of my stay before the health insurance kicked in, or I received the card that bureaucratically put me in the system to automatically get payments from the government. And so I did dip in at the very beginning to some emergency funding, which was really, really helpful.
And that kind of has us already talking a little bit about our next question, which is how did you receive accommodations abroad, and how did you navigate this process? I mean, maybe Kristen, you could give a little bit more color on kind of. It sounds like you needed some health support. So maybe you could describe a little bit more what that looked like on the ground, doctor's visits, hospital visits, and maybe kind of maybe how the French healthcare system also worked with that.
Absolutely. So I, at first going into the process, knew nothing about the French healthcare system, spoke French, but it was coming from a situation where my parents had never been abroad themselves and didn't speak a different language. And I was the first in my family to learn a new language for many generations. And so it was a little bit intimidating, I'll say, to my family and to me, the idea of trying to navigate a new system in a different language. So I sat down right away with my advisor at William and Mary, talking about some of my concerns. The one challenge that I think we faced, despite her absolute willingness to ask questions and do research, was the language barrier. I was the only one who spoke French. In the study abroad office, there was no one who spoke French. And so there were a lot of cold emails that I did to hospital groups in France, or cold phone calls I made to hospital groups in France, explaining my situation, saying I need an appointment with a doctor for when I arrive. And these are the medications that I use, translating my list of medications into French, doing that type of kind of procedural work. I was fortunate to have like a close family friend who speaks French and was able to lean on them to be able to translate those materials, to ascertain which are the best healthcare providers to target my outreach to. And I was lucky that I found that it was most effective to actually reach out to university hospital groups rather than private practice, because there are some amazing leading rheumatology institutions at university hospitals. Montpellier is actually like one of the best rheumatology centers, hubs in the world. So it just so happened that I was tapping into a really well-resourced community, and I was able to make that connection, get in touch with a doctor who set an appointment aside for me for the first week I arrived. And then once I arrived, was able to transition my materials there. With health insurance, it was complicated. It was a little easier actually for my undergrad experience, arranging the necessary health insurance needs, because they had insurance, travel insurance through the undergraduate university that covered pre-existing conditions. And so we knew to contact that insurance company. That was something, since the insurance company spoke English, that was something that my advisor did very effectively. It was reach out to them and ensure that they could cover the cost of my treatments in France when I got there. And so they were in constant communication with the hospital group I identified. The health insurance company reached out, provided information about the degree of coverage. And in France, since they actually need coverage prior to the treatment, not like the US where you can just get treatment and figure it out after the fact, they were able to arrange all of that in advance of my stay. So I knew the day I got there when my appointment was, and they scheduled my infusion for the next week. Slightly more complicated during my Fulbright scholarship, but I think we'll get into that. So I'll save some time since I've been talking for a bit.
Thanks, Kristen. And I've been making notes, so in case you leave anything out, I'll make sure to ask you at the end. I appreciate that. I was actually thinking about adding a question about research and what that was like, but you just answered the whole thing. So I'm going to toss this question on to Emma. So what kinds of accommodations and supports did you receive abroad while in Madrid, and what was it like navigating the process, especially the healthcare system?
Yeah, I can speak to that. Thanks, Justin. So I received academic, housing, and food accommodations while abroad. And I was able to handle a large chunk of the housing and food accommodations in the US with my advisors on site, or not on site, at U of M. And so I basically sat down with my advisors at U of M and I said, these are the housing accommodations that I will need access to. And they were able to communicate with the provider program in Madrid and get something sorted out for me. It is worth noting here, I did have to pay a little bit extra just to get the housing accommodations that I need. And it wasn't too bad, but I always just like to disclose that. And so yeah, so that was how that worked for housing. We did also let them know like what type of, because I have a digestive disorder, we let them know what type of foods I can't eat. And then that also was something I also considered, but I forgot to mention, was foods of the general area, like what type of foods the culture generally eats there. So yeah, I received food and housing accommodations, which I mostly handled at U of M before I left. And then for my testing accommodations, I did let the center know that I had testing accommodations before I left. And then when I arrived, was when I kind of was able to sort things out and talk with teachers and advisors and let them know that I needed some extra time on exams. And then another accommodation I received that I think would be important to speak to here was a lot of my doctor's appointments for like my infusions and such. They're not open on the weekends and or after business hours. And so I had to work a lot with the program to basically get my absences excused. And so a lot of abroad programs have very strict attendance policies, which is something really important to know for a student who might have a chronic illness or somebody who is immunocompromised like myself, because if you know that you have to be at an infusion or a doctor's appointment and you have to miss class, that's something that you're going to want to make sure that you communicate with the program, because for my program specifically, I could miss 3 classes per like the whole semester. So that equated to like 3 days for a whole winter term. And so I had to work a lot with getting doctor's notes and talking with professors and just saying like, hey, I might be a little bit out of this attendance policy. This might not be really realistic for me. And so that was probably the most important accommodation that I received abroad. But other than that, I think that covers my general accommodations abroad.
Thanks, Emma. And that was a great last point. I mean, I know in my conferences I've attended, the attendance issue comes up a lot and causes a lot of anxiety among providers. So, but you make a great point that there are certain times when it's pretty non-negotiable for the student. One of our externs actually is doing a project about being abroad in Kazakhstan, and she's a celiac and she's in the breadbasket of the world, and so you can kind of see the irony. I'm curious that from your point of view, were there any cultural like foods that you had to avoid in Spain?
Yeah, certainly. I never had, for anyone familiar, I could never try paella, which is like anything with tomatoes. So I'm very allergic to tomatoes and red meat. And so I could never try a couple cultural foods. Um, and trying to think, it was and it wasn't an issue. So I had like a dining hall, and so I could kind of pick and choose what I could eat. But then when we went on group dinners, which our program did take us on like group meals, I would just have to like, I had my name on a list, I think, and they would bring me out like a separate dish. But yeah, it was something that when I got there, I wasn't expecting, because they do cook a lot with tomatoes in Spain in general, and I know like a lot of parts of Europe. So that was something that I just always had to be on the lookout for. But I would say I'm on the lookout for it a lot in the US also. So it wasn't something that I had to like turn on when I was abroad. It was something that I always have in the back of my mind, I would say.
Thank you. That's awesome. Flipping on to the next slide. I'm going to toss this next question to Kristen. in terms of pre-departure preparation, what could your home institution have done better?
Yeah, so I think they did in undergrad everything that they could. They were a pretty small study abroad office. But I sort of wish that they had made more even in the absence of language services that they had. I wish that they had maybe gone to try and acquire French language speakers to be able to help me navigate some like really important phone calls. I felt a little bit like it was on me to figure out on my own, which on some level, I was ready to advocate for myself, but on other levels, it was quite overwhelming with imperfect French to make some cold phone calls and explain my whole situation and healthcare terminology in a language that's my second language. So I wish that I think something they could have done better was make those language services available. Another thing, which is more, I mean, a little bit less concrete, but equally important, is I wish that there had been individuals who were committed to getting me there, people who were confident that it was possible. And I think that I had this sense as I was navigating this process for the first time that I was the first person in the world who had ever done it. I mean, it felt so lonely. And I think had I not had the really amazing support of my family, friends, or individuals in my life who had been abroad and had health conditions, I don't know if I would have been able to stick through it because my parents were incredibly afraid, even of, you know, a country that's not dissimilar to our country in their minds or culturally. I think that it is a really intimidating thing to send your child who grew up with an autoimmune disease to a new place to navigate a healthcare system that's completely different. And if your host institution isn't there to at least make it seem feasible, it won't become feasible. And so that's something I just kind of want to instill, is the extent to which we can make this sound possible, even to the students who come in asking questions like, is this possible? Yes. I mean, we exist. Me and Emma and many other students have done this, and we do it every year, and we're here to help, and you guys are here to help, and I'm grateful for that. But I just, yeah, to the extent that you guys can be cheering squads or find the cheering squads that are ready to help us in the face of myriad obstacles. I think no one is entitled to a study abroad experience, but people with disabilities are just as capable and can benefit just as much and can contribute just as much to those opportunities. So it's important that we make it seem possible.
Very good points, Kristen. Thank you. Your story about making phone calls to organizations in France reminded me of when I was trying to research alternative media resources for blind people in Uruguay, and actually like the novelty of like getting on Skype and, you know, calling the library in Uruguay and like being super nervous whether I'd understand the person or not. Anyway, going on to the next question here. This one's going to be for Emma. So while you were abroad, sorry, there was a interruption. While you were abroad, what kinds of gaps and challenges did you experience with the home and or host institution? And so could you describe that, Emma?
Yeah, absolutely. So for me, I think everything was going well until I had to get an infusion scheduled. And then there was, I would say, definitely a gap there. And so I had primarily been working with U of M up to this point, in terms of getting all of my accommodations in line. And then my on-site advisors were basically there to just give the okay stamp of approval. And so I basically ran into an issue with insurance abroad. And so I was covered by the university insurance, which is GeoBlue, by the University of Michigan. And so I was covered by GeoBlue, excuse me, but then I also had to purchase the IES insurance, which was the program insurance on site. And there was a discrepancy there because the on-site advisors felt more comfortable navigating the on-site on-site insurance, and so they would recommend certain places to go, and certain providers to see. And then I was also, on the other hand, working with my U of M advisors and GeoBlue, and they were suggesting something else. And so that kind of led to like a little bit of a discrepancy. And something else that I think is worth mentioning here is that the on-site insurance that I had through my provider program was basically like you went to the doctor and then you paid the doctor and you kept the receipt, and the insurance would reimburse you for whatever you paid. And so I knew that was going to be a problem for me because my infusions costed anywhere from like 10 to 15,000 euros for one infusion, which is pretty, I think in the US is about $15,000 for one infusion. So it's a really expensive drug, and I knew that I didn't want to like put myself in a situation where I could potentially have to give or have to pay 10,000 euros like on the spot to and then have to wait to be reimbursed. And so that was a really big I guess it was a really big issue for me because I had to decide if I wanted to go with GeoBlue. A lot of my advisors aren't actually on site to help me with this. But then at the same time, if I stayed with the on-site recommendation, would I potentially put myself in a financial position where I have to pay a lot of money and then wait to be reimbursed? And so that was a really big gap that I faced. And yeah, I think with the help of my advisors at home, they were super, super helpful. We were able to find a provider through GeoBlue where I wouldn't have to pay out of pocket. And basically I just had to go to get a new diagnosis because they didn't accept my American diagnosis. So I just had to go see a doctor, get a new diagnosis for ulcerative colitis, and then I was able to get my infusions through GeoBlue, which was super, super helpful. And I didn't have to pay anything out of pocket. It was all covered upfront.
This was a different plan under GeoBlue.
Yes. So I went with GeoBlue for most things, and then I had the on-site, like the IES program, which was a separate insurance, which was basically through the on-site university in Madrid.
Oh, okay. Yeah, I'm trying to just figure out like if that extra plan that you picked up that didn't involve the copays or the upfront, having to pay 10,000 euros upfront, if that was if it was a travel health insurance plan or if it was just like a local healthcare plan, just a Spanish healthcare plan.
Yeah, so sorry, I might have explained it a little bit wonky, but so U of M requires that for all students that go abroad that they have GeoBlue, which is the university health plan for U of M students. And so that was the one that I had. So, and that was mandatory for being a U of M student. And then to go abroad on this program, IES, they also had a mandatory health insurance, which was through their program. So they were two separate insurances from two separate institutions. And I had to have both. I had to pay for both. It was a requirement for U of M, and then it was for the U of M students, and then it was also a requirement for the students who went to this host institution program. Does that is that more okay?
Yeah, that
Sorry
makes
if I
sense.
explained that bad.
That makes sense. Thanks, Emma, for that. So
We
let's
have a
see.
few questions in the chat,
I
Justin.
was just about to
when you-
ask you. Why don't you read those out, Lori? Let's go
You
through the audience
bet.
questions.
Well, one question is, what information did you receive during the research program identification process that was helpful in your decision-making process?
Who wants to pick that up?
I'm happy to jump in. I think that the research on health insurance was just a total black hole as I was navigating the process. So it was really, really helpful when I understood the mechanics of what health insurance was and was not available to me as I was identifying what country to go to and what program to engage in. So, for example, with my more recent study abroad experience in Paris, I had navigated France before, but that was on student health insurance with the benefits of a group plan that had been designed with my university, of which I was a part. But as a Fulbright scholar, I was subject to their insurance, which does not cover pre-existing conditions abroad. And here in the US, I was on Aetna, my parents' insurance at the time. And Aetna would not cover me for my pre-existing condition abroad. So then I did tons of research navigating, trying to figure out if there were any private health insurance companies that would cover me for international coverage. And I was repeatedly denied on the basis of my pre-existing condition. So it was actually a really, really big gap for me. And no amount of research, no amount of time I put into it was able to provide an answer so much as when I realized, okay, well now information is helpful to the extent that it shows me that I have to go to a country that will provide me health insurance coverage for being an employee. So that's why I was an English teaching assistant in France. Aside from really being excited about the experience, English teaching assistants are government employees in France. And so as soon as I got there, I was entitled to Social Security in France, which provides up to 70% and more coverage for people, notwithstanding pre-existing conditions. They have no basis for declining you. And so I was able to then kind of resituate my research on figuring out French health insurance companies that might be able to provide top-up coverage, the extra 30% coverage that I needed, which are also not allowed to decline you on the basis of pre-existing conditions. So I think knowing first, what is your home country, what's available to you in your home country, and two, if your home country is falling short, what's available to you at your host country, or maybe that will inform which host country and the programs you choose to engage in. And I see here someone saying Fulbright did not cover because of pre-existing conditions. That's true. Right now, their health insurance company does, or their coverage, or at least in 2021, when I was engaging, their health insurance coverage does not cover pre-existing conditions. And I would be more than happy to discuss this with anybody because I could go on a whole rant.
Yeah, what's the name of that? It's because I think it's also insurance that's in all ECA program plans. I forgot the name of it.
Yeah, I'll look it up and put it in the chat.
Anyway, generally, yeah, that is an aspect of it that pretty much whether you're participating on the Fulbright or on any other ECA sponsored program, that you pretty much have the same travel health insurance, which doesn't cover pre-existing conditions. Did Fulbright provide any sort of extra kick-in support, any like assistance with co-pays or anything like that at all?
So that's where it came in, that it was really transformative, the emergency funding that they were able to hook me up with. So in collaboration with my country director, I got in touch early on, disclosed my disability during the application process, but in much more concrete terms. Once I was accepted, I got in touch with them right away. And they made funding available to me, additional funding that covered that extra 30%, because the coverage that the government health insurance wouldn't offer. So I ended up ending the year without healthcare costs associated with the program, but I had to be prepared to pay that 30% for my treatments and prescriptions, et cetera, in out of pocket until I was able to get that reimbursement through Fulbright.
Got it. Got it. Yeah, it's I think we could all probably rant for a while about the government travel health insurance, but definitely definitely Fulbright has been able to kick in other ways even without that. But I appreciate that, Kristen. We're pretty much out of time, but I did want to see one last question for our professionals, maybe Ayesha in particular. Is there a particular type of I'm just trying to figure out, is there a particular structure of like, we know that the travel health insurance plans will say, okay, we cover pre-existing conditions, but is there kind of a typical set of rules that all the plans follow or that they tend to follow? Like, is there a deductible that you have to burn through? Is there a certain percent copay that you have to have? I think you mentioned earlier a few of them, examples, like it matters when you contract the insurance, for example. Is you the student or is it the institution? I was curious if maybe you could give us a little bit more detail on that, kind of the anatomy of a typical pre-existing condition coverage on your typical travel insurance plan.
Yeah, great question. And travel and health abroad insurance, it definitely varies from institution to institution. So I'll speak a little bit from the University of Michigan perspective, but based on my conversations with other schools as well. And so for health insurance abroad, there are like sort of key main providers that several institutions in the US partner with. Some are like GeoBlue, CSI, Chubb. There's like a whole list of different insurance providers. So each institution goes through a contract and negotiation process, and they will sort of decide how many specific coverage items they'll have, what's like sort of the upper limit in terms of maximum coverage. For example, University of Michigan has a $500,000 coverage limit. Some institutions have about 250,000. Some institutions have unlimited. So it really varies in terms of the coverage limit. And then within the benefits themselves, one key thing is that institutions in general that are larger have more power to negotiate with an insurance provider because they anticipate higher travel volume. And so some institutions cover the cost of the insurance on behalf of the students. For University of Michigan, students pay for the insurance at a per day rate. But because we're such a large institution, we're able to negotiate a lower per day rate, which is, I think, right now $1.71 per day. But smaller institutions don't have that leverage, unfortunately. And so they might not get the best plan. They might have more exclusions. They might be paying a higher daily cost. And so it really varies in terms of there's no standard insurance across the board. There are known insurance providers that, like, because of that relationship, we are able to push for certain coverage. For example, pre-existing condition, that was like a non-negotiable item for us. So if we were bidding for a new insurance provider, that would definitely be a requirement, and we wouldn't work with a institution that would have it. And so for GeoBlue specifically, students or any traveler who's going abroad, they don't have to pay a deductible or a copay. It depends on if they're going to in-network or out-of-network provider. If they're going to in-network provider and request a guarantee of payment, the student shouldn't pay out of pocket. If they go to out-network provider and they do have to pay out of pocket, they can submit a claim for reimbursement. So that's sort of the general process. But as Emma was hinting, some institutions might just have a standard, you pay out of pocket initially, and then you file a claim for reimbursement. So it really varies across the board. And that's why it's very important to, if you are in that space of working with insurance providers at your institution, to consult with your peers to see what they're doing and kind of push for those better coverage benefits at the onset, so that the student, of course, is not dealing that while they are abroad.
Awesome. Thank you. That's really helpful, Ayesha. All right, well, that brings us to the end of our webinar, and we've got like 49 people on this webinar. Still, I'm totally blown away you all stuck with us, and I really appreciate it. I hope that you will fill out our satisfaction survey, which will go out at the end of this webinar, and also keep an eye out for a recording, which will include captions. The recording will be sent out in the next couple weeks or so. And that also concludes the last of our spring webinar series. I hope that you'll continue following us, join our newsletter to learn about upcoming initiatives. There's still chances for applicants to submit proposals for our campus collaboration initiative. Essentially, if your university wants to do a little capacity building or support a staff to go to a conference, we've got a little bit of funding that we're offering to institutions who want to either expand their own capacity for campus collaboration between study abroad and disability services, or to expand education and information in the field to support collaboration between like disability and international education to support more students to study abroad. And thank you so much, everybody. With that, we're going to draw this to a close, and we hope you'll keep in touch.